And last but not least, in our e-poster roster for this year's annual ESRS meeting in Copenhagen, therapeutic customized surface ablation to manage severe contact lens related infectious keratitis. And I have the honor of presenting this same material at the American Academy of Ophthalmology Cornea Day on October 19th in Orlando. Again, we're in Copenhagen, and this is something that we unfortunately see very common, a contact lens related infectious keratitis. The bug was killed by antibiotics, but steroids were not probably used timely, and a significant dense scar is generated. This obviously obstructs vision, but it creates a significant cornea flattening in that area. And you can see how terrible this scar is on anterior segment OCT. On slit lamp by microscopy here, and you can see the OCT maps showing the epithelial irregularity. If this patient is contact lens intolerant, obviously a keratoplasty technique is in play here, but we will present a series of how we tackle this with a topography-guided ablation. You can see here how the ablation is trying to treat around the flattened area and steepen that area and normalize the cornea. This is the outcome on that patient. Afterwards, you can see the scar has become more faint, and the cornea has thinned some, and this is the before and after. But more impressive are the topographies. For instance, here you can see how irregular this cornea is before. It becomes far more regular, the very effective change, and nothing I think underlines the improvement more than this. This is the difference map of before and after on this very dense scar. And I think I'd seen this lady. This lady came in from California to Athens. I'd seen her like 6 years ago, and just this last year she came back because the only option in the US was for her to undergo penetrating keratoplasty, and we're able, with topography-guided treatment and cross-thinking, to improve her to this remarkable point and achieve 20/40 vision without correction. So we're seeing here some of the caveats of employing customized treatments in very irregular eyes, in this instance severe cornea scars, most of them as a result of infectious keratitis, again underlining the fact that contact lens wear is more dangerous than laser vision correction today. So we can't push people to have laser vision correction, but at least have to be aware. And this is a way how to manage some of these very severe complications. Last one, again, this is a contact lens related infection that ended up with a very severe scar. You can see the density and the depth of the scar. We obviously cannot remove the scar with any technique besides cornea transplant, but we can make it much more faint with our topo-guided approach and CXL. And this is what we're highlighting in this e-poster. Thanks so much for watching. John Kanellopoulos, clinical professor of ophthalmology at NYU Medical School, director of the Laser Vision Ambulatory Surgery Center in Athens, Greece. We're Copenhagen, Denmark, this beautiful city, for this year's 2025 annual ESRS meeting.